My name is Elise, and I'm here at the Breastfeeding Clinic with Dianne and her new baby Max. Today we're going to listen to some of Dianne's concerns and see if we can come up with some solutions together. Congratulations on your new baby. How old is Max?
He's 3 weeks old.
And what brings you into the clinic today?
Well, I'm having a couple of issues that are making breastfeeding challenging. Often while Max is nursing, I notice milk dribbling out of his mouth and running down his chin. When it's not leaking out, he's falling asleep at the breast. Sometimes he falls asleep as soon as my milk starts to let down. It can be frustrating at times, but I'm determined to breastfeed him for as long as I can. My midwife told me it's especially important for babies like Max who have Down syndrome, as it can prevent some infections.
It sounds like you two have had some challenging times learning to breastfeed. It's really great that you feel so strongly about persevering despite the challenges you've had. Many moms and babies need support with breastfeeding, not just those affected by Down syndrome. I'm so glad that you took the initiative to ask for help. How do you feel about Max's diagnosis?
Well, my dreams about motherhood never involved having a child with Down syndrome, but now that he's here, I'm amazed at how much I love him. We've really bonded with each other, and I couldn't imagine not having him. I do have some concerns, though, about the challenges he might have. For example, do you think his feeding issues are caused by Down syndrome?
It makes me so happy to hear about the amazing bond you've developed. To answer your question, yes, sometimes babies with Down syndrome do take longer to learn how to suckle well. This is because the muscles in their mouth and jaw are weaker. Also, their tongue may be larger and protrude from the mouth. This makes the coordinated motion that is needed to obtain milk from the breast more difficult, and it can lead to a weaker latch, which is why you may have noticed milk dribbling out of Max's mouth. Babies with Down syndrome can also be more sleepy, so it takes them more effort to get less milk. Sometimes they fall asleep before they finish eating, or even as soon as your milk lets down, like you mentioned. If you'd like, we can talk about some strategies that have worked for other parents.
Well, that would be great.
There are a lot of options. Are you interested in feeding Max expressed breast milk, or do you prefer to feed him at the breast?
Well, ideally, I'd like to continue feeding at the breast. It just seems simpler to me. Do you have any suggestions?
Absolutely. I can show you something called switch nursing if you'd like.
Okay.
So I'll get you to go ahead and latch Max on.
Okay.
Okay. When you notice he's starting to get sleepy or lose interest, you can gently break the latch by sliding your index finger into the corner of his mouth. And then right between his gums.
Okay.
Okay, and then you can remove him from the breast and switch him over to the other side. You can repeat this as many times you need until he seems satisfied. Sometimes it can help to do a little breast massage or compression just to get the milk flowing and make it easier for him. I can also show you a technique called dancer's hand that might help to stabilize his jaw. This might improve his latch and decrease the amount of milk dribbling. So to do this, you just cup your breast with the first 3 fingers.
Okay.
And then that leaves you with a little U shape, your thumb and your index finger.
Mm-hmm.
And you can use that to gently apply pressure to Max's jaw.
Oh, okay.
Is it okay if I touch you?
Yes.
Okay, so your thumb is just going to go on the other side of Max's jaw like that. And you can apply gentle pressure and even pull his jaw forward a little bit.
Okay.
So that's going to strengthen his latch. And you might notice that it decreases the amount of milk you see dribbling. How does it feel?
Well, it does feel more secure, actually. I feel like he doesn't have to work as hard anymore. It's very comfortable.
Oh, I'm glad to hear you think it might work for you. Do you have any other questions or concerns you wanted to chat about today?
No, I think we have plenty to practice for now. I'm excited to try these new tricks out, and I hope they help Max become better at nursing.
I'm excited for you two as well. I hope you'll reach out if you need any support in the future. It helps to remember that all babies, including those with Down syndrome, usually become better at breastfeeding over the course of their first few months.